All right, I am giving a report on April Peters. She is a 10-year-old female presented into the ED with a history that was diagnosed 3 months ago of acute lymphoblastic leukemia. She presented into the ED with a sore throat, a temp of 101.2 that has been unresponsive to Tylenol, and her last chemo treatment was 2 days ago. So she had a new diagnosis about 3 months ago, and along with that diagnosis and that, her white blood cell count was 469,000, showing hyperleukocytosis. And also presenting on her diagnosis, she had a short history of headaches and pallor, as long as going along with it. She admitted into the ED on 7/8 of 20 and then was transferred up to the oncology peds floor. Her family social support: dad works full-time as an engineer. His name is Tom. Mom is Cindy. She stays home to help with April's care, and also their other 6-year-old daughter, Maggie. Currently, April has not been able to go to school due to her immune compromised state. So she has had a tutor helping her with her schoolwork, but lately she has been withdrawn from wanting to see any friends or even talk to them. She is a full code, no known allergies. Her activity is decreased from weakness being immune compromised. She is a high fall risk. We want to place her close to the nurse's station for monitoring. Her IV maintenance: she has a 0.9% normal saline bolus, 20 ml kg over 60 minutes, and then we also gave her D5 half normal saline with 20 MEQ potassium chloride at 2 ml kg an hour. Her IV site is in her right AC, but she also has a CVAD machine. Her diet: she was presenting with dehydration and malnourished, especially from her complaining of a sore throat that's showing an adverse effect from her chemo treatment. So we want to call up a dietitian. I have called for one, and they said they'll be coming shortly. We want to increase her protein, have her on small, frequent meals, give her some Ensure, increase her vitamins and supplements. Currently, she weighs 57 pounds. Her height is 51.5 inches, and she is 13.5 pounds underweight for her average weight of 10. Her vital signs trends when I did her assessment was 100.8. Her pulse was 112, Respir's 24, BP 106 over 66, O2 96 on room air. Her relevant assessment data: she appeared pale, skin was cool to the touch, cap refill was 3 to 4 seconds, showing lethargy and drowsiness. Again, abnormal from her baseline. Sore throat is a new thing for her, so that's showing, again, adverse effect from the chemo. Didn't have a telirhythm. So her relevant labs: her sodium was 130. It is trending up. It was at 129. Yep. Her creatinine is at 1.4. It is worsening, so it is on that borderline. I mean, the normal range for it, the normal high is 1.5, so we do want to watch that. Her white blood cell count was 0.2. That is worsening. It was 0.36 before. Her hemoglobin is 7.4. That's also worsening. Platelets 54, worsening. It was 61. Neutrophils is 1, and prior it was 0. Albumin is at 3.5. That is worsening. Her most recent was 3.9. Total Billy is at 1.0 now. Again, that is also worsening. Her ALT is at 42. That is worsening. It was at 20. Her AST is at 49 and trending down, or trending up. It was at 21 before. Her lactate is 1.8. Prior, it was 1.7. So she is almost at that critical value. Ionized calcium is at 1.05. That is also worsening. Her amylase is at 29. That's worsening. Lipase at 31. Worsening. Magnesium is at 1.9, and that is worsening. It was at, or actually that is improving. It was at 2.0 before. She is appearing unstable and is showing that she was in septic shock, but she is clearly in MODS now from showing neuromuscular dysfunction, her liver dysfunction, pancreatic is showing dysfunction now, endocrine from her ionized calcium, and potentially her heart as well. So we do want to get a telerhythm or telemonitoring on her. Our priority goals is we want to treat that infection with the ulcers and increase that tissue perfusion for her vital organs. As long as we're getting that malnourishment up and getting her nutrients, that's going to be our biggest priority. We want to do vital signs Q15 minutes for the first initial hour, especially for every initial hour, and administering her antibiotics. We want to do strict INO, daily weight. So new orders and PRN meds. We did a strep and throat culture. We're still waiting on that. Daily blood draws. Continue close monitoring of all of her labs with vital signs. She is on Tylenol 160 milligrams per 5 ml Q4 hours. Ceftriaxone 75 milligram kg Q 24 hour. Vanco 15 milligram per kg per day Q 6 hours. We want to monitor with her Vanco the peak and troughs before each dose because of her MOD, so we really want to closely monitor that. Educational priorities and discharge plan, fluid resuscitation, educate on how to keep herself hydrated, educate over pain and fever, when to call the PCP if a temp is greater than 100.4 degrees Fahrenheit. We want to educate her mom and also April herself on positioning at home when she is bed rest to make sure that her skin is not getting broke down. We want to have dietitian education, teach the mom how to do an INO log and daily weight log. Currently the patient is responding comfortably now. Continue to monitor closely. She is on neutropenic precautions. Any loose ends to do. So I have called palliative care, social work. I asked mom and dad about their cultural beliefs. They have a pastor, so they are all being called. Home health needs to be called still, and dietitian. They have all been called. They just need to come up and give those educations, so just make sure we follow up with that. Any questions?